This is Dr. Christy Webb, psychologist in Chapel Hill, North Carolina. The diagnosis of borderline personality disorder is one that strikes fear into the hearts of many psychotherapists and patients. This group of people has a reputation for being manipulative, attention-seeking, suicidal, self-harming, and demanding. Therapists often fear being burned out by them. I love working with folks with BPD. They're usually highly intelligent, sensitive, and funny people who are in a lot of pain. Where others see manipulation, I see someone who doesn't know how to get her needs met effectively. I don't see the suicidal gestures as attention-seeking, but as signals of just how desperate my patient is. What is borderline personality disorder? What causes it, and what can be done to treat someone with this complex diagnosis? The characteristic feature of borderline personality disorder is frantic attempts to avoid real or imagined abandonment. The person with BPD, who is usually but not always a woman, might threaten, "If you leave me, I'll kill myself," or might buy expensive gifts for people in order to keep them as friends. In addition, she has unstable and intense relationships in which the person can go from hero to zero in a matter of instants. Your best friend doesn't return your call immediately, and boom, she's out of your life. There's an internal emptiness, and the person doesn't know what she likes or dislikes. She feels alone, sad, and hollow. There's a lot of impulsivity in areas that have a high potential for harm, such as unsafe sex, overspending, binge eating, and substance use. There may be recurrent suicidal threats or behavior, and or non-suicidal self-harming behavior, such as cutting or burning oneself. There may be mood swings, which is why this diagnosis is often confused with bipolar disorder. The person is often depressed and or anxious. Anger is especially likely to blow up suddenly and unexpectedly, and when angry, there may even be momentary paranoia or dissociation, that sense we have sometimes of leaving our body. In fact, this is why it's called borderline. The person is always on the borderline between normal neurosis, which is what we all have, and psychosis, seeing things other people can't see, hearing things other people can't hear, and under sufficient stress will fall over the line into psychosis. In order to get the diagnosis, a person has to have at least 5 of the 9 characteristics that I mentioned, so just having mood swings is not enough to get you the label. Like all of the personality disorders, borderline personality disorder cannot be diagnosed before the age of 18, but the seeds of the disorder are sown in very early childhood. We're learning that the brains of people with BPD are different from those without it. For some reason, the child seems to have been born with emotional sensitivity and little to no ability to control her emotions. Something that most people would take in stride is very difficult for him to tolerate without freaking out. These children don't learn that nothing and no one is either all good or all bad. They see things in red light, green light, or all or nothing terms. Add to this emotional sensitivity an invalidating environment, and you have a recipe for BPD. So what's an invalidating environment? Well, that's one in which the child is told that what she is experiencing can't be true. She says, "I'm hungry," and she's told, "No, you aren't. You just ate. You can't be hungry." Or he's crying and is told, "Don't cry, you don't have anything to cry about." Not all people with BPD have an abuse history, but many do, and this makes sense because abuse is the ultimate invalidating environment. Not even your body is your own, and when you say no, it's either ignored or contradicted. Alcoholic homes are also a breeding ground for borderline personality disorder. The gold standard of treatment for BPD is dialectical behavior therapy, DBT. DBT teaches skills to this group of people who were never taught them in the first place. They learn to tolerate distress without making the situation worse and without harming themselves or anybody else. They learn how to regulate their own emotions. They learn how to have healthier relationships, and they learn how to tune in to their own thoughts and feelings without either impulsively acting on them or avoiding them. Another treatment approach that is getting more attention recently is mentalization-based therapy. This teaches people with BPD to distinguish between their own thoughts and feelings and those of the people around them so that they can understand the effect of their behavior on others. This helps them to grasp that they're unlikely to get what they want, for example, by having angry outbursts. Probably the best known example of BPD in the movies is the Glenn Close character in Fatal Attraction. Now, unfortunately, this has given the public a one-sided and frankly terrifying view of the diagnosis. I often suggest that people think of Marilyn Monroe or of Princess Diana for other examples. And Marsha Linehan, the creator of dialectical behavior therapy, has very courageously come out as having the diagnosis herself. What's important here is that one can have a rich, full, and accomplished life, a life worth living, right alongside borderline personality disorder. It's entirely possible, although therapy is usually necessary in order to achieve that goal. Thanks for joining me.